Hello, everyone, and thank you for joining us. My name is Kelly Haynes Mendez, and I am the Senior Director of the Human Rights Team at the American Psychological Association. In today's panel, we will provide an overview of disability status and human rights, the psychological science on disability, inclusion, and intersectionality, and we will conclude with highlights from the American Psychological Association's efforts to address disability issues within its equity, diversity, and inclusion framework. So first, I'd like to introduce our panelists. Dr. Kathleen Bogart is an associate professor of psychology at Oregon State University. She is a social health psychologist specializing in disability, ableism, and rare disorders. An advocate for people with disabilities, she has served on several boards, including the American Psychological Association Committee on Disability Issues and Psychology. Passionate about disability community building, she is the co-founder of the Disability Advocacy and Research Network for psychologists who have and/or specialize in disability. In 2019, she co-edited the Journal of Social Issues special issue on ableism. Her research has been featured in The Atlantic, New York Times, Time, Science Magazine, Financial Times, and Inside Higher Ed. Dr. KJ Connor is the Assistant Vice President of Academic Administration at Alliant International University in California. Until recently, she was an associate professor in the Clinical Psychology PhD program at Alliant International University in Los Angeles. She has published quantitative and qualitative research articles on disability topics, including physical disability, microaggressions, and clinical work with physically disabled clients. She is a current member of the APA Committee on Disability Issues and Psychology. She is also a licensed counseling psychologist in private practice, working with queer, trans, and non-binary and disabled clients. Dr. Emily Lund is an associate professor of counselor education in the Department of Educational Studies and Psychology, Research Methodology, and Counseling at the University of Alabama, and a visiting professor at Iowa Women's University. Their research focuses on disabled and multiply marginalized communities, with particular emphasis on interpersonal violence and trauma, suicide and non-suicidal self-injury, graduate education and training, and LGBTQ+ issues within those communities. They have published over 110 peer-reviewed publications, 2 edited books, and 18 book chapters, and are an American Psychological Association Fellow in Rehabilitation Psychology. Dr. Lund is currently the chair of APA Committee on Disability Issues and Psychology and serves in the advisory group for the APA Disability Mentoring Program. And finally, Dr. Megan Vanderhilst is the Director of Disability Inclusion and Accessibility in the Equity, Diversity, and Inclusion Office at the American Psychological Association. Her primary focus has been on advancing disability awareness and equity across the association. She has also served as the Director of the Disability Issues and Psychology portfolio at APA. Previously, Dr. Vanderhilst was the Director of Healthy Athletes, a program at Special Olympics which provides free health screenings to athletes and promotes equitable health care for individuals with intellectual and developmental disabilities. At MedStar Georgetown University Hospital, where she was a practicing audiologist, Dr. Vanderhilst co-developed and managed the Georgetown Cochlear Implant Program. And so first, I want to go to Dr. Bogart, who will share some of the main points of the right to science for persons with disabilities according to international human rights standards and conventions. Dr. Bogart?
Yes, thank you so much for having me. I'm hoping that my screen is sharing properly. And I'm happy to kind of present an overview to kickstart our conversation about this topic, the right to science for persons with disabilities. So as attendees of this conference are aware, the UN has put forth a number of principles for the right to science. And today I'll be focusing on some disparities that people with disabilities experience in the right of everyone to enjoy the benefits of scientific progress and its applications. So first, what is disability? Well, the UN Convention on the Rights of Persons with Disabilities says that basically disability is the intersection or interaction of physical or mental impairments and social barriers. And in fact, 16% of the world's population experiences significant disability, making it the largest minority group in the world. And that is 1.3 billion people. And 80% of disabled people live in developing countries. Disability intersects with all other identities and is especially likely to occur among people who already have a minoritized identity. And disability is the only identity that you can either be born into or that you can join in at any time in your life. So today I'll talk about a few key topics that highlight the intersection of science and disability. So first I'll talk about the case of COVID-19. We are aware that COVID-19 kind of kickstarted a number of scientific advances. However, there are disparities for a number of minorities in their ability to access these advances, and that was also true for disabled people. So for example, the CDC in 2021 reported that disabled people were less likely to receive the COVID-19 vaccine, despite being less hesitant than the general population about getting vaccinated. And reasons for this were reported barriers in scheduling and location access. Of course, COVID-19 also skyrocketed the use of telehealth, which really presented some risks and rewards for the disabled population. So we must ensure that telehealth is accessible for people with a variety of disabilities, especially those who are blind or deaf or have intellectual disabilities. Telehealth is not a replacement for certain types of care that involve physical examination or physical manipulation. However, it can be a very useful tool for people in order to help them increase physical access or obviate the need for physical access to providers, regardless of distance. And this is especially beneficial for people with rare disorders who are very unlikely to have doctors or specialists who are familiar with their disorder in their local area. Speaking of rare disorders, I want to highlight this as a minority within a minority. This is a type of disability that is defined as rare when it affects 1 in 2,000 or fewer people. And there are more than 7,000 different identified rare disorders. 300 million people around the world are affected by a rare disorder, so the experience of rare is actually common. And there are a number of disparities that these individuals experience in terms of access to scientific advances. So for starters, simply accessing a diagnosis can take an average of 7 to 9 years. And once they have a diagnosis, only 5% of rare disorders have approved treatments. And we know that the psychosocial experience of rare disorders is uniquely challenging. So people experience a number of types of stigma because the public is not aware of rare disorders and how they present. And they also experience a need for social support. However, there's a lack of evidence-based psychosocial interventions for this community. And I want to highlight one more minority within a minority. And this is people with facial differences or facial disfigurement. And indeed, facial differences are included in the UN's definition of disability, but they are not explicitly named. So many governments are unaware, and individuals are unaware as well. So this means that people with facial differences are especially likely to go unprotected, and particularly in developing countries, experience a number of human rights violations, including being shunned, being hidden away, denied education, employment, and land or property. And stigma reduction research is especially needed in this area. And I want to point viewers to the International Human Rights Organization, Face Equality International, who actually did a video presentation to the UN this summer and about these issues, and that was recorded. So if you would like to learn more in depth about these issues, please check out that video. So thank you so much for your attention. I hope that this kind of shows a higher level idea of some of the topics that we might discuss today.
Thank you so much for those wonderful insights and wonderful lessons around human rights issues and disability issues. I now want to move into a discussion with Dr. Bogart and Dr. Connor around some additional issues. The first question I have is, how has psychological science addressed the importance of disability inclusion and accessibility? I have a second part to the question, but I'll wait.
Thank you, Kelly. So my background, so I'm Dr. KJ Connor, she, her, hers. My background is in applied psychology, counseling psychology in particular. So I'm glad that Dr. Bogart is here as well from a social psych perspective. But within, the applied psychology fields, there is, quite a commitment to diversity, multiculturalism, social justice. However, within our literature, in looking across decades, about 1% of the published empirical research focuses on disability. And so, there is a real dearth in evidence-based practices for how practicing psychologists, can work in an evidence-based way with clients with disabilities. And it leaves also the field of education and training without a basis for training students, offering continuing education that's grounded in research and science to prepare psychologists to work with disabled populations.
Thank you. Dr. Connor, I'm sorry, Dr. Lund is also here.
Dr. Lund, yeah, sorry, and I was having difficulty finding the link.
Emily, or Dr. Lund, you've got my name up on the screen just for everybody. There are two of me, thank goodness. This is Dr. Emily Lund.
Yeah, thank you all for having me. I totally want to second what Dr. Connor had said about the dose of virtual. And I think that dose is in large part driven because in science, including psychology, we still see disability as kind of a bad outcome rather than a demographic or culture kickback or an aspect of diversity. So when you see disability discussed in literature, often how do we avoid it? How do we eliminate it? How do we get rid of it? How do we incorporate it in a culturally competent manner and culturally way? And the same thing with training. Some of us are working in the 15 lab, but still, when you look up disability in the psychology training literature, when it discussed it all until recently, like 10 to 15 years ago, pretty much all you saw was basically an article on how do I kick a disabled student program out being sued. And so disability and diversity, disability culture, disability as national identity is something we're working on integrating in the field, but we still have a long way to go and a lot of historical and current ableism and intersectional ableism to address in doing that.
Thank you to these two great answers. And to that, I will just quickly add from a social psychological perspective that social psychology has long kind of neglected to include disability as a social identity, but things are changing, right? So social psychology has a long history of studying stereotyping, prejudice, and discrimination of minoritized groups. And historically, this is focused on ethnic and racial minorities. However, more recently, research by myself and some people on this call and some members of my organization, DARN, have been publishing about disability as a social identity and topics around disability identity, which I have collaborated with Dr. Lund on, and disability pride. So I think these are really important things for more, we would say, quote, mainstream psychology to focus on, rather than looking at disability as kind of a niche topic that should only fit under kind of rehabilitation psychology.
Those are excellent points. The second half of this question for the three of you is, how has psychological science addressed the impact of discrimination and ableism?
One thing I want to add on to what Dr. Bogart was just saying, and then going into the second half of this question, is that, you know, because disability hasn't been viewed as an identity, hasn't been viewed as an identity that is a diversity variable like other diversity variables, that is often left out even in demographics questionnaires, that it's not something that when people are designing their study or collecting basic demographic information about their samples, that it's often not included. So in terms of like the foundation of psychological science, there's less, you know, we miss out on the data that we could have about disabled populations, because even in general studies, it's not asked about very often. With regards to discrimination and ableism, one of the things that I've noticed within the literature is, you know, it's hard to design quantitative studies on disability discrimination and ableism when there aren't a lot of measures, psychological scales that have been evaluated in terms of psychometrics in order to look at specific disability specific phenomenon related to discrimination and ableism. So there, you know, more and more scales are coming out, but it has not ceased to surprise me over the years what scales we don't have and that we need in order to even begin to explore these things quantitatively.
And I, that was a great answer, Dr. Connell. To add on to that, I think we're still kind of very much not emphasis in addressing ableism and um, discrimination effectively in all research. And I think big part of a big part of the progress made had been being able to recruit and retain more disabled psychologists and more multi-marginalized disabled psychologists into our field, because often having those people who have both the scientific and clinical knowledge and the lived experience have been really critical in pushing the research and the conversation forward, not just to ableism, but also how to relate to intersectional ableism. So the complexity that ableism as a form of discrimination against people with multiple marginal identities. So I would underline that the topic where representation really matters, because representation has been a lot of what put the continent and the field forward.
And, I actually don't have much to add to those excellent responses. So I think that this need for measuring disability status as a demographic variable is super important. And Dr. Connor points out this issue that many of us deal with around not being able to measure the variables that we're interested in. I'm going to promote a measure that Dr. Connor has created, because they don't want to self-promote, but they created a disability microaggression scale, an ableist microaggression scale, right? Which could be a useful tool.
Thank you. And I'll say the reason that I created that scale was because I wanted to use that scale, and then I found that it didn't exist. So sometimes we don't, seek out to create, measures, and yet if we have such a dearth of available measures related to disability populations that it becomes necessary to do that. But thank you.
Thank you. Moving our discussion forward, I want to ask the three of you to respond to this question. What are some of the issues that intersect with disability status and the impact of disability inclusion and accessibility on these issues?
I'll answer that, and I just wanted to briefly take on something Dr. Bogart said. It's not just ableism we had difficulty measuring, but also in disability itself. There's new ways you can act with disability, depending on the study. Some people the blanket question, do you have a disability? Some people do you identify with a disability? Some people do you have the diagnosis? Do you have these symptoms? And what we know in our research, some of the research Dr. Bogart and I both have done, is having a chronic health condition does not always equate to someone identifying as having a disability. And there can be a lot of reasons that I can internalize ableism. So the topic how you measure disability itself is actually important, and it's something that needs to be studied and addressed well in the field. Add to the question that, like I mentioned earlier, one area that we really kind of wrap in the field that I think we're growing is the studied how disability interact with other marginal identities, other forms of discrimination. The experience of disability, LGBTQ plus able people, and other multi-marginal groups. It's something that's really understudied, and oftentimes with looking at multi-identity or discrimination, we tend to put those in silos. We tend to say, okay, we're looking at ableism now, we're looking at race now, or we're looking at gender now, or we're looking at sexual orientation now. And we often don't consider and don't examine how those experiences might intersect, even though we know they do. One study I read when I was an undergraduate, that really thankfully had a profound impact on how I think. What a wonderful study the experience that disabled people tell when accessing domestic violence services. And what they said in the study was they will basically they want disability competent services, or do they want services that were competent to their racial ethnic background? And because they were forced to make that impossible choice, a lot of times they met the accessibility need that came with that intersection. For example, interpreters who were familiar with particularly the sign language used in the Black and African American community in the US, because people weren't willing to examine those intersections. So that's something you really need to do in the field, and do deliberately and do purposely, is examine the way disability intersect with other marginal identities and what that experience is like, and how it can be different from the experience of trying to silo aspect identity, which itself can feel really dehumanizing to multi-marginalized people, because they're actually an impossible attack to trying to isolate simply one part of the experience. And we know that sort of impossible, and people really can't do that effectively or meaningfully.
Thank you, Dr. Lund. And yeah, I don't have a lot to add to that, but that I think one of the things that interferes with looking at the intersections of disability, or for people to think about disabled people as even having other identities, or, you know, rich and full lives, other parts of the self, are some of, you know, the stereotypes and ideas that people have about disability. That, you know, if we're looking at intersections with gender, you know, disabled men, you know, how do we make sense of, you know, if disability is related to weakness, you know, how does that make sense with masculinity? Or if men, you know, shouldn't ask for help or have vulnerability, how is there a reconciliation between the interdependence of disability and the independence of masculinity? Or with LGBTQ people, if disabled people are asexual, how can they be, you know, queer or gay or bisexual? So I think people don't have trouble putting those pieces together, that disabled people have these other parts of self that are relevant to their experiences in the world, because of these, you know, stereotypes and assumptions that are made about disabled people. So in order for people to, you know, look at the intersections, they need to see disabled people as whole and full, just like able-bodied people.
Dr. Bogart, do you have any social psychology perspectives on this question?
I think they have covered it so well. You know, social psychology really does focus on kind of these other minoritized identities that we kind of have historically denied disabled people to have, right? So I think there is a real opportunity to kind of build from the research that has been done in social psychology on these other minorities, and right, complicate it, add nuance by including disability as an intersection to those identities.
Thank you very much. I saw lots of head nods and thumbs ups and heart reactions as we were having this conversation. I want to invite participants to post your questions in the chat. We will, or in the question and answer portion of the webinar, we will have some time at the end to respond to your questions. And each of our panelists will have an opportunity to respond to your questions at the end. So I appreciated hearing some of the psychological science on these issues. And now I want to discuss some of the types of organizational programs in place to support these issues. Dr. Vanderhilst will answer the question, what are APA's own contributions to disability inclusion, both within the association and within the field of psychology?
Thanks, Dr. Haynes-Mendez. So APA is a mission-driven organization that applies the best available psychological science to benefit society and improve lives. We strive for an accessible, equitable, and inclusive psychology that promotes human rights, fairness, and dignity for all. And that includes people who identify as disabled and neurodiverse. So over the past 4 decades, we have established policies, programs, groups, and resources dedicated to disability inclusion and accessibility. We've participated in multiple consortiums, work groups, and task forces to advance disability equity and advocate for the rights of people with disabilities. And we've developed statements and responded to requests for information from US governmental agencies and the UN Human Rights Council. So first, I'll speak to our policies, since really they are the foundation of the work that we do in service of our membership, the field of psychology and society. So in 2019, we adopted the resolution on support of universal design and accessibility in education, training, and practice. And this resolution reaffirms APA's support of the full participation and inclusion of people with diverse needs and abilities. The resolution also advocates for a move toward infusing universal design principles and accessibility throughout all of APA's actions, programs, and policies. And in 2022, we revised our guidelines for assessment and intervention with persons with disabilities. And one of the key revisions included the addition of a call to the field of psychology to be advocates and allies, inclusive of serving those with disabilities. Another example of our work is our APA Disability Mentoring Program. And this program has been supporting psychology trainees with disabilities and disabled psychologists for over 20 years. We also have our Committee on Disability Issues in Psychology, or CDIP, which you may have heard us talk about earlier in the bios, because Dr. Lund is currently the chair of CDIP, and Dr. Connor is a current member, and Dr. Bogart is a previous co-chair of the committee. But basically, this committee was established in 1985, and they've aimed to ensure that APA is considering the psychological welfare of people with disabilities in all that we do. In the next month or so, we will be releasing our updated APA Inclusive Language Guide, which includes a section on person first versus identity first language. There is a disability section that highlights ableist language and suggested alternatives. And we also have added a section on neurodiversity. So stay tuned for that. And so, while we continue to address disability issues in psychology, we acknowledge that there's still more to be done to ensure that people with all types of disabilities feel welcomed and included at APA. So currently, our APA Equity, Diversity, and Inclusion Office is leading the development of a conceptual framework called the Accessibility Inclusion Maturity Model, also known as the AIM. And the AIM will support the integration of best practices around all aspects of disability inclusion and accessibility throughout the association. Infusing universal design and inclusive design into the fabric of APA will be at the core of this framework, as well as ensuring that we are consistently evaluating our progress and incorporating feedback from our partners and experts with the lived experience of disability every step of the way. And so all this is to say that APA has has done a lot in the past several decades to support people with disabilities in the field of psychology and in society, but there's still more work to be done. So if you're trying to figure out where to get started with disability inclusion in your own organization or in your own work, I highly recommend that you check out APA's recent Essential Science Conversation that we held in partnership with the Disability Advocacy and Research Network, so DARN, the organization that Dr. Bogart co-founded, and with the NIH. And this webinar was titled Barriers for Individuals with Disabilities in the Scientific Workforce, Current Data and Recommendations for a More Inclusive Field. And there should be a link to this free webinar in the resource handout that you received. And so I guess I just want to leave you with a little bit of perhaps some wisdom I've gained doing this work. Perhaps my biggest piece of advice when trying to advance disability equity for your own organization would be to continue to evaluate your progress. Center the voices of those who identify as disabled and are neurodiverse. APA is always striving to do more and to do better. We never rest easy, and we are constantly trying to ensure that disability inclusion remains a part of our conversations around equity, diversity, and inclusion.
Thank you so much, Dr. Vanderhilst. That is a wonderful summary of some of the activities that the association is doing. I want to invite the panelists at this point to respond to some additional follow-up questions. I heard you all mention disability inclusion, and we are psychologists, and our audience will be scientists from various fields here with us today. So one of the follow-up questions I have for the group is, why is it important to support the inclusion of scientists with disabilities in the various fields of science?
That's a wonderful question. One critically, I think, is it because disabled scientists have insight, ability, and knowledge that can really limit the field, that we just choose to exclude an individual and exclude their knowledge and talent and experiences. We could be missing out on some great discoveries, great thing that puts our field forward, because we just choose to overlook entire subset of the science population and an entire subset potential excellent researchers and colleagues and PI, just because they have disabilities, and we as institutions are not willing to take the time to address inclusion, to create accessibility, and make sure that people can thrive and do great work in our fields.
I think Dr. Lund said that really well. We're missing out on insights and great knowledge. They're not including disabled people. We bring in unique perspectives that have not been really heard before. One thing I want to speak to that might be at a larger level, we've talked about some of the barriers to including people with disability in science and psychology. Those include things like pipeline issues. We have more people who enter psych in undergrad than who are able to graduate and move on if they are disabled, relative to people who are not disabled. So those are real issues that, APA, for example, is working to address, as Dr. Vanderhilst noted. Another thing I want to point out is that we tend to hold in psychology and in science a stigma around people conducting self-relevant research. So that is disabled people researching disability, right? Because we have this idea that science should be completely objective. I have a lot to say about that, but we need to acknowledge that science cannot be completely objective, that we all come in with our own perspectives and lived experiences, and we need to be transparent about that. We need to acknowledge that our diversity can strengthen the field of science, right? And so by including, the knowledge of people with disabilities, as Dr. Lund pointed out, it really does enrich our field. And we need to be sure to not further stigmatize these already minoritized groups who really have the best insight about these experiences. And I think kind of taking that a step further, we need to do a better job of doing participatory research, or what we might call community-based research, right? That includes disabled people as co-creators at every stage of the research. So that ensures that we're asking the right questions, the ones that really matter to disabled people. This ensures that we design accessible studies, that our recruitment is effective, and that our participants trust us, right? Because minoritized people, including disabled people, may have a mistrust of science because of harms that were done in the past. And this ultimately results in more effective research, better translation of our findings, and real effective problem solving. So I'll leave it there.
Thank you both so much for those excellent points. It made me think a lot, so thank you. The only thing that I'll add is that research, a lot of research can't get done without funding, and so it depends on who's in the room to determine what gets prioritized when there's limited resources. So we need disabled scientists to be in those rooms and to be decision makers, because when there is that lack of representation, like Dr. Lund was saying, that the topics and populations that are relevant to people with disabilities can get sidelined, and when there isn't funding, the research doesn't happen.
Adding on to this, another component I thought of during my colleague lecture exposition was simply that you probably do have disabled trainees that you don't know are disabled, because when we build a culture of disability inclusion and more explicit about disability diversity and disabled scientists and student training being welcome, people are more likely to disclose, to receive accommodations, and to be able to achieve their full potential. What we know from some of the research I've done and my colleagues have done on disabled training and psychology, and applied to other fields around my experience, in that a lot of time trainees with disability, particularly with disability that are invisible or not very apparent, don't feel like they can ask for accommodation because they feel that stigmatization and discrimination from their institution and from their PIs. So they often wait until they're at a point in crisis, when they're on a performance improvement plan, to bring up disability to ask for accommodation. We had an accommodation that were often very simple, very straightforward, for implemented from the beginning, that would have never been an issue, and that individual would have been able to work to their full capacity from the beginning, because they were felt comfortable and felt welcome in discussing disability and receiving the necessary minimal accommodation at the beginning.
And I'll just add, thank you so much, Dr. Lund, for that. I want to just add that, those fears are founded too, that disability discrimination is real, and some, whether it's an employer or an educator or an institution, that students, trainees, employees really are afraid of asking for accommodations because there is the reality that some of the time they'll face, faulty and damaging assumptions about who they are, their reasons, their abilities. And, it's a form of self-protection against ableism.
I want to add to that as well. I think these are really important points that we're kind of building. I wish it weren't the case. I wish that what Dr. Connor is discussing were not the reality, right? That psychology created safe spaces where people felt comfortable disclosing and being out about their disability. So one thing, I want to add, kind of thinking about that idealized situation, is the way we make that better, in addition to, openly talking about, let's have conversations about accommodations, the requests and things like that, as Dr. Lund pointed out. The other way that we do it is that people in power who are disabled and who are relatively privileged come out, right? Come out as disabled. The majority of disabilities are invisible, so we wouldn't know unless people came out. So if you are at an institution where, say, you have tenure or you're a full professor or otherwise in a place where it is relatively safe for you to do so, you can help people who have relatively less privilege in the kind of ableism hierarchy, right? By coming out and saying, hey, I'm here, I can be a mentor, I can be a role model, and I can also be an advocate for issues that I'm seeing at the institution.
That great. One last thing to add on what you said, Dr. Bogart, it's also critical to include this within the marketing material, to include it in your diversity sheet, because oftentimes disabled applicants are going to look at that and part of kind of trying to figure out if the program would be open to and welcoming to and inclusive of disabled individuals or not. Because for the reason of very real discrimination that everyone had mentioned, people aren't going to disclose that in that they feel like they had some indicator the environment is this really inclusive, this really formative. And for very real reason, of not wanting to ask the question and suddenly had the interview canceled. That question and suddenly not getting interviewed, which are very real things that some of the disabled participants in our study and some of my disabled colleagues that I have experienced. So addressing the marketing materials, addressing those statements to make sure they're truly inclusive with disability, and that you show that throughout the recruiting process, throughout the onboarding process is very critical as well.
Dr. Vanderhilst, I wanted to give you an opportunity to respond before I move to our last question.
No, I think actually everyone here has already made excellent points. I think there was something that Dr. Connor touched on, sort of spurred some of the additional conversation around invisible or non-apparent disabilities. And I think something that perhaps may be helpful for the folks who are in attendance today is thinking about the fact that providing accommodations, or I should say, thinking about accessibility from the onset of whether it is the research you're conducting, or perhaps it is a course that you're leading, if you're in the academic setting, that you are thinking about accessibility and disability inclusion right from the very start, because just statistically speaking, there's going to be several, whether it's several students in your class or several participants in your study who are disabled and are neurodiverse. So thinking about accessibility right from the very beginning is something that is not only going to be helpful for those folks, it's going to help them feel included, to be included, but also a lot of the times those accessibility practices are benefiting everyone in the group. So perhaps it takes a little bit of effort to change your habits, especially if that's not something you're used to doing. That's not something that's in the forefront of your mind. So it really does take some behavior change there. But I wanted to point out, and like I said, I'm thinking about in particular about those folks with non-apparent disabilities, because again, just because you can't see the disability doesn't mean that it doesn't exist.
Thank you so much to each of you. I feel so fortunate to have you here and to be part of you sharing such expertise in these areas. So as a final question, the topic of research has come up with, I think, each of your comments. And so as a final question, I wanted to ask, because I think it'll be relevant to other participants and throughout science. How can one appropriately include people with disabilities in their research, and why is that important? I think you responded to why that's important, but some examples, I think, Dr. Connor, you talked about, creating your own tool because you wanted to do the research. So I'm interested around this research question. Dr. Lund?
What Dr. Wilcox's knowing about community-based participatory resource, CPR, and I think really critical to this, including people with disability, both community partnered and disabled colleagues and collaborators, because they bring different perspectives. And well, it's really critical to this, and including that, really allowing them to shape your study rather than trying to just have them sign off on what you're all going to do. It's critical. When I'm talking to people who sometimes bring me in as a consultant and collaborator because they want to do CPR with people with disability, they often say, okay, we all decide what we're going to do. We need the community panel with disability to say that it's okay. And I always tell them that not what CPR is. You need to allow the community member to critique, to suggest changes, to actually impact what you do in your study and how you do it. Even if that does take more time, even if it does force you to make changes to maybe what you had in mind, and to really truly involve the community in that, and to involve them in every step of your research, from the planning to the dissemination, is really critical, I think, in that.
I'll add to that. I agree that I don't think that many people are actually doing community-based participatory research in its kind of true intended form, right? So I think that's a really important thing to highlight. It's hard. It takes longer, as Dr. Lund said. It is not as efficient compared to the traditional model where there is one PI. But it's so important, and it means that our research is more likely to actually be implemented and make a difference. A couple of other points that I want to bring up that we should do in our research, and this is great combined with participatory work, but we need to be sure to, at the very least, communicate our findings back to the people who participated. This is not common in mainstream psychology, at least in the circles that I go in, right? So it's this experience of, okay, we're going to have a participant or as we used to call them, subject, right? engage in a task or do a survey for 20 minutes or whatever, thank them, send them away, and never hear from them again, right? And they never get to benefit about what was learned, what their own specific findings were, perhaps, and how it fits into the larger field, right? So that's an important part of just like, I think, ethics in terms of educating our community. That also has the benefit of then allowing it to kind of trickle into our community more. And now the next step that we really should be doing is what's called member checking. So not only do we tell our participants about what we found, but we ask them to give us feedback about the accuracy of it and whether we missed anything, right? And so that really helps us to know that the findings that we have are accurate and representative, and enhances their ability to be applied.
I'll just tack on to that piece about giving the knowledge and information back to the participants, just how much participants like that. That I have found, in conducting qualitative studies in particular. I like to send a summary of the findings to the participants as soon as the data analysis is done, and then send the article once it's published. Of course, it's like years later. But that one thing I have been surprised about is that in asking participants, do you want a summary, and then do you want the research article? I found 100% of the time the answer is yes. So this is something that our participants are largely very interested in, and helps to build and maintain that relationship between researcher and participant that's based on a foundation of respect.
I think also sharing the findings in a way that is accessible to the participants, both in the format filling it in, like make sure it's something like screen is accessible, but also in the language you use. We can sometimes, as Lawrence said, use very technical language that may not be accessible to our participants. So you may give them a journal article, but that may not be accessible to anyone in your participant pool other than people that have to get a PhD in the same field as you. So also making sure we provide either in a way that is truly accessible and informative to the population is really critical.
Thank you so much. With that, I want to conclude our panel. Thank you so much for our guests for joining us today for this hour. Thank you to each of our panelists for sharing your expertise with us. And as a final thanks to Nate Weisenberg and Teresa Harris, who are the AAAS Human Rights Coalition, for inviting us to be a part of this conference. Thank you very much.